All right, Landon, hit the disclaimer. Today we're here with Nicole Bart. She's the newest member of Live Oak, and she is a dietitian. And when it comes to weight loss, nutrition is going to be the biggest driving factor of weight loss. Exercise makes a difference, needs to be part of your program, but the majority of your weight loss is going to come through nutrition. And nurse practitioners, and doctors for the most part do not get very much dedicated nutrition time with any of their schooling. And so with Live Oak having a significant weight loss portion, I wanted to bring in a specific dietitian to help oversee what we're recommending with people and have additional avenue for follow-ups and make sure that what we are saying is appropriate. And so I wanted to have her on and help spread her expertise. And so thanks for coming on.
Okay. Thanks for having me.
The kind of Live Oak initiation podcast.
Yeah. Okay. Let's go. Let's do this.
Can you introduce yourself? Give it some background.
Yes. So my name is Nicole Bart. I'm a longtime San Angelo girl, born and raised here. I did go away to college. I have a degree in exercise physiology. I also have a degree in nutrition and wellness. So, I'm from here. I've wonderful husband, 26 years married, 2 girls, both living their best life at Texas Tech.
Nice.
So, I love being a dietitian, and this is going to be great.
It's funny, San Angelo just has a way of bringing people back, and I don't really even know why. So I chose nursing initially so I could get a job anywhere in the country, and this is going to sound pretty terrible, but I've never lived more than 40 miles where I'm sitting right here, in my entire life.
Yeah.
I'm comfortable. I don't plan to leave or anything, but
Great place.
But it just seems, like with Goodfellow here, people pass through, come in, and then a lot of people find their way coming back. But one of the first questions I want to get and establish is, what is a dietitian compared to a nutritionist, and what is that verbiage specifically?
Sure. Yeah, that's a great question. So registered dietitians, we are qualified healthcare professionals. We've gone through intensive training. We have an undergraduate degree, master's degree. We have to sit for a national licensure exam that we have to pass. We have to, in the state of Texas, I have to maintain a license here. I also have to keep up with the continuing education. And so that's registered dietitians. Nutritionists, they do have some training, and you can go through some schooling or some certifications. They just don't have the licensure requirements that we have as dietitians. And so we are different in that area.
And so that's why I wanted to bring a dietitian specifically on with Live Oak, is just one to review our protocols and make sure the information we're giving people is, the most up to date with everything. And nutritionists, they have some input. They just don't have the formal training, credentialing.
Right. Correct.
That you would be getting with a registered dietitian. And nutrition is just so stinking nuanced and hard, and like even just looking at the studies is hard to what they control for, what they don't, and then just the people aspect of nutrition, so just having someone that's been doing it, and you've been doing it for a long time. When did you start?
Let's see here. I graduated from dietetic school in 2002.
Okay, nice.
Yes, I've been doing this a long time.
Have you been all outpatient? Did you do any inpatient?
I've done a little bit of it all. I did start as an inpatient dietitian, and I did that for many years. I've done consulting. I've done pediatrics. I've done the older population. Outpatient, specifically bariatric, obesity. Gosh, I've worked for Region 15 with early childhood interventions. So I've done pediatric nutrition. So I really feel like I've gotten the experience across the board, and I really have loved all of it. So, but yes.
Nice. Awesome. And so we'll dive into kind of nutrition, some of the topics that come up a lot. And social media drives a lot of the discussions that we get a lot. And it can be good in some for giving information out there, but some is just so difficult to decipher through. It's like we'll have bouts where, carbs are bad, never have a single carb, and then fats are the devil, We can't have fats if you want to lose weight. And then, but now fats are good. You can have all the fat you want and it doesn't change anything negatively. Protein's getting the limelight now, and I'm on board with the protein currently. I can't see that going away from everything we know, but there's always new information. But, at some point too, sometimes it's like, then people will be like, well, protein's overhyped. We don't need that. And so it's like, after all, if you look at everything, then it's like, all right, well, there's nothing even left to eat.
Right.
So what is it even, how do you start? How do you view nutrition, and like, what does a healthy diet consist of?
Gosh, it's broad. It truly is. But when I look at what is nutrition, if you look at the science of it, and I'm a science nerd, so I do a lot of science-based, evidence-based practicing. Nutrition is what we fuel our body with. So social media has made it hard, or different avenues other than the true basics and facts of nutrition. It has made our job very challenging. I spend a lot of time keeping up with the current fad diets. I keep up with what's trending, what's not, just so I'm aware. So when patients come in, I have the answers for them, or the best answers I know. A healthy diet, it's, of course, good protein. So I'm on board with proteins, but I'm also on board with complex carbohydrates, including fiber foods. I'm also on board with heart healthy fats, because I think those are all beneficial. I view nutrition and healthy eating as moderation. All foods can fit. I never like to tell somebody you can't have something, because I don't think that's fair. But I do say, majority of the time, let's give our body good fuel. Fuel makes us go. It's kind of like gas in the car. We don't have any fuel, we're not going anywhere. So I feel like if we have good, solid foundation nutrition of good proteins, lean meats, complex carbohydrates, heart healthy fats, the other things will fit, but those are our primary building blocks.
And so, one part of nutrition, so the biggest population we have at Live Oak is typically people wanting to lose weight. So we utilize GLP-1s and everything. And I try to, how I want patients to view like any meds is, one, I want to talk about what their lifestyle looks like without meds, get the lifestyle in check, but also build that lifestyle that's conducive for weight loss. And that way we're just needing a little part of the medication. We have 75 to 80% of lifestyle driving their weight management, and then we're just filling in the last little bit with a GLP-1 or any of the other anti-obesity medications. And so when you zoom out, weight loss needs to be in a calorie deficit, an energy equation. And so it's simple to say, but not easy to do, And so how do you approach somebody who's wanting to lose weight? Where does that start with them?
I think you're right. We have to look at lifestyle. And so I think that we all have we're all busy people. And so I think weight loss is something we all, of course, that's a big thing. That's why we have so many new weight loss drugs and things that are coming on the market. But I think we have to look at, it's not supposed to be quick. I think weight loss is supposed to be healthy. I think that we have to approach it as consistent behavior. What fits in our lifestyle? What can we do? Just small, simple changes. I can go back and forth and say calories in versus calories out, but I think there's better calories than some. And so I think that we have to look at it as a whole as, what are you eating? What are you drinking? How much are you moving? Are you eating out? Do you eat at home? Do you intermittent fast? Do you practice a fad diet? So when I visit with patients, I really get down to the root of what their current habits are, and then we go from there.
Yeah, and it's, just meeting everybody where they are, because
Exactly.
Each person is going to be different in terms of, I'd say in like my stage of life, where I talk with a lot of patients that are like my age or around, is kids and their extracurricular events. And so traveling is hard to stay in control.
Yeah.
It's because you're just kind of at the mercy of whatever's around with you. But do you have any travel tips for staying in a calorie deficit, and how to almost pre-plan travel while still eating somewhat decent?
Sure, I think that's true. We've come out of that phase of our life because our kids are older, but I definitely remember having that you're on the go. What am I going to take? What am I going to eat? And you're stuck to concession stand or convenience stores. And so that, if you're in a weight loss journey, that can be really challenging. So I really encourage patients you have to plan ahead. And sometimes that's harder than others. And so, but planning ahead, take some things with you that hey, this is going to keep me, on path to meet my goals. I know sometimes we're going to not have those opportunities and we're just going to have to make the best choice we can when we're out. But I think it's planning ahead. Take your protein bars, make sure you have your water, make sure you have some good snack alternatives so you can reach in your bag and pull something instead of going and grabbing a bag of chips or a bag of M&Ms from the concession stand. So I think it is planning. It's truly plan ahead. And I tried to keep a snack bag in the car with us that I would refill anytime, but I always kept it with us. So we always had something if we needed it, whether we were on the road or just going from practice to practice. You have something in the car that is helping you meet your goals.
Do you have what are your favorite go-tos?
My favorite go-tos. I've started doing more protein bars, and I don't have a favorite one. I'm still going. I look and see, this one looks good, or this one looks good. Let's see. I love the little protein packs. Sometimes they have to be refrigerated.
Yeah.
Nuts. I love nuts. You can always keep fruit in your vehicles. It doesn't have to be cold. Let's see here. Even little peanut butter or cheese crackers. That's still better than chips or something that is convenient. So I think it's just making better choices.
And the protein bars now are decent. Like they get 20, 25 grams of protein. They're not 400 calories.
Right.
And I used to eat them I don't know when it was, early 2010s or so. And they just tasted like eating an eraser.
Awful.
Almost.
Yeah,
They're so
that texture's
dry.
terrible. Yeah, gritty, grainy. I'm a texture person, so I'm out on those. But yeah,
now
they're not
they're
bad.
good,
Yeah.
And you don't they can be super calorie dense and very easily, but for the most part, they're pretty decent and work them into your calories. And so that was another question that I have that I skipped over. One of the exercises that I typically have patients do, and I can always just feel their life drain out of them whenever I want you to count calories for a little bit. And I know it sucks, it's time consuming, but I am doing it so that they can build some calorie awareness. If they've never done it, man, it's so insightful on just to see how many calories are in everything you're eating, how many calories you get in a day. And then you can play with looking at other things, how many calories are in everything. And then it makes it easier to make lower calorie substitutions because you're like, oh, I still like that. Is that what you do, or how do you approach their energy balance?
So I agree, calorie counting and knowing where your calories are coming from is so important. I have to be mindful too sometimes though with certain individuals, it's really stressful for them. And so I like to fill it out and exactly meet that patient where it is or that client where it is. And if I feel like that's going to stress them more and they're just going to give up, we're going to go another avenue. If you're good, and you're okay with calorie counting, I definitely say that helps me know where to help you.
Right.
Because I think, I can tell you what I ate yesterday, maybe 2 days ago, but if you ask me what I ate 3 weeks ago and we're in a visit and I say, what have you been eating the last 4 weeks since I last saw you? I think most people are going to be like, oh, I don't really know, because we're just so busy and we have so many things going on. And so calorie tracking, calorie counting, knowing where you're getting your nutrients is super beneficial as your journey for weight loss. That's your ultimate goal. Or if it's training, these athletes who are training for big events, or just seeing where they're getting their nutrients, where are they lacking, where are they overshooting. I think tracking it and counting them is very important.
And I try to simplify it a lot and just get my kind of philosophy. A lot of it is, we'll try and figure out a calorie goal based off their basal metabolic rate or resting metabolic rate or something. And, give them a calorie goal and get a protein goal to try and not overwhelm them. But the other macros are important. How are you viewing that, and are you giving macro goals along with it, or how are you viewing that?
I do like to give goals because I think when you have a goal and it's written down, is it attainable? And, is it sustainable too? Like, what are you doing to help get there? So I will give clients calorie goals, protein goals. Let's look at your fats. Let's look at all of it. Hydration, that's another huge thing. I think hydration is very important, and so many people walk around dehydrated. So I will, when I meet with clients, I will give them those specific goals, and then I'm going to educate them and help them. How do you get there? And how do you count these? How do you know what a gram of protein is? How do you know how to count your fats? How do you know how to count your carbs? I'm going to do all of that with them.
Okay, good. That helps a lot.
Yes.
And the fats, it's even something, in the 90s is like fat was demonized, and there's so many low fat, zero fat options. And fat is a crucial part of it in terms of helping you feeling full. It helps with your hormones. And so I like fat, but then also now the carnivore guys will go way overboard, and they're throwing sticks of butter in their coffee, and I'll see cholesterol levels. It's wildly impressive at how high they can be. But I guess we'll kind of transition to that specifically. How does like keto and carnivore, how do you approach somebody who's wanting to do that? Because they, I would say West Texas guys eat a lot of meat, and they're like, I don't really like vegetables anyways. If I can just eat meat all day and bacon, it sounds amazing. But
who doesn't love bacon?
How do we approach that if that's what they're wanting to do? Is that a viable option, or what do you think about it?
That one's a hard one because originally, years ago, the ketogenic diet was more for neurological disorder. And so when you look back at why and when that was developed, it was critical for those patients with those things. We've taken that today, and I think we've changed it a little bit because meat, and it's just, my husband, he's a meat eater, and so I have to be very careful. I can talk out of two sides of my mouth when it comes to keto, carnivore, some of those. Again, I have to look at the person's lifestyle. What are their goals? What are they aiming for? But I think we have to be careful with high fat intake. Where are your fats coming from? Are we talking monounsaturated fats? Are we talking polyunsaturated? Are we talking saturated and trans? Where are those fats coming from? We know fats, particularly the not so healthy fats, directly linked to heart disease. So we have to look at that and say, okay, where are we getting these fats from? Fats are also twice the calories per gram as a protein and a carbohydrate. So though they may fit in our total calorie goal, are they the best use of our calories? Like, are we utilizing them appropriately, or we're just using them because they make food taste really good? That's flavor, right? And so that's why foods taste good. So I think we have to be careful with some of those higher fat. Can it be beneficial? When you're trying to, achieve a certain goal, does it fit into your lifestyle? But can we look at healthy fats, healthy sources of your meats on carnivore, looking at the leaner types of proteins, not your higher fat proteins. And that's where we come in and we really design that plan with clients is where can we fit these healthy options, but what are you eating? What are you following? And let's tailor it and tweak it to help you, again, meet your training goals, meet your weight loss goals. It's all about the client. It's all about the patient. And so that's where we come in as dietitians and we just start really breaking it down. Because like you said, you guys as clinicians don't have that time to do that. And so that's where we work together as a team, and that's the betterment of the patient, ultimately losing 100 pounds or training for certain things or building muscle or losing fat. That's how we put all of those together. But as far as your higher fat diets, kind of those fad diets that are happening right now, I have to really just be careful and say, where are they coming from? Is it harmful long term? Or is it going to be beneficial? I think sometimes when we're on the keto or we're on carnivore, we're eliminating those really good carbohydrates. We need carbohydrates. Our muscles need fuel, and carbs glycogen, all comes from those good carbs. So if we're not getting those carbs, we're missing out. Our body is missing out on good fuel.
And I don't want guys or gals to be scared of, fruits and honey.
No, yeah.
They're very micronutrient dense. And, I think, carnivore may have a place as like an elimination diet. We've talked that,
Right.
If a guy wants to do it, it is decent for the short term, because they can eliminate other stuff, especially if they're having other problems and they start reintroducing, some other gluten or dairy back in, and then they start getting negative stuff. It's like, okay, well, we can, just avoid that. And so it's a decent elimination diet, but it's something that I don't think they can adhere to.
Yeah, it's not sustainable long term. Sometimes too, like the more I've read about it, sometimes you've got some GI issues. You just have to take into account. I think sometimes you're still missing key nutrients when you're eliminating really good food groups. You're meeting some of those things, but you're eliminating a lot of some of those vitamins and minerals and key nutrients you need from other sources than just meat and animal proteins. So I think that's, again, we have to look at the big picture.
One of the other diets that I probably somebody is trialing daily these days is intermittent fasting. And, my kind of view is it can work for some, especially if it fits their lifestyle. They're busy trying to go, they hit the ground running in the morning, lunch, all this stuff. But I'll say my personal experience with it is that it just wasn't for me. I would get weak and shaky. I was trying it back whenever I was in the emergency department, and I was like shaking like crazy, suturing, and I was more irritable. And even though I only was giving myself like a 6-hour eating window, I was overshooting my calories because I was so hungry that that's one of the ways that it is good as a weight loss deal, is because it keeps you in a calorie deficit, because it's hard to eat 2,500 calories in 4 to 8 hours,
Right.
but I could way overshoot it. And so it just didn't work for me. I have some patients that do amazing on it, but what is your view with the intermittent fasting?
Again, I think it can be useful in certain situations. It is, in my opinion, it needs to be used temporarily, not a long term, because it's not sustainable. And I think that's what we keep talking about is these things, are they sustainable long term, or is it a quick fix? And so I think intermittent fasting can be helpful temporarily for a pre-diabetic or somebody who's got some metabolic issues and we're trying to help them reset. I don't think long term it's helpful because, like you said, you're hungry, you're irritable, you're sleepy because you don't have those nutrients. Food is fuel. And that's what I try and help my patients understand is don't view food poorly. Like, food is not the enemy. And so food is so important. Nutrients are so important. And so a couple of things I've seen with intermittent fasting, I do too have some patients that it has worked well for, but over time it stops working. So we really have to readjust and kind of reset and go back to, okay, what's not working and let's change what's not working. I feel like if somebody's trying to get 2,000, 2,500 calories in a 6-hour window, you're giving your body too many nutrients at one time for it to utilize over time. And so like you said, you overeat because in their mind, and I think in our minds, we're like, I haven't eaten all day. I can eat what I want. Or I'm going to just grab and go. I haven't eaten all day. I need something quick. I don't think we're making good choices when we get to that point. And agree, I think we've got some brain fog when we're not eating and we're not fueling appropriately. We're more irritable. Hormones are way off. Our hunger hormone is really displaced some. And so while intermittent fasting can be fine in the short term and for certain people, I don't feel like it's for everyone. And so I think we have to look at them again as the individual person and look at what can we do? Even if that means, if you think of fasting or a normal eating cycle, if you think of like you eat breakfast, say 7:30, 8 o'clock in the morning, and you're finished with dinner by 7 o'clock at night, That's still a pretty decent fasting window from 7 p.m. till 7:30, 8 o'clock a.m. That's still that's normal. That's a normal eating habit. So I look at it more that's probably more sustainable versus eating only from like 11 a.m. to 5 p.m.
Right. Yeah. And some of the guys, the ones that do well, again, it fits their lifestyle and they report they get better mental clarity. And I just kept pushing through trying to wait. And it just never came to me to want, because it was like, well, if I can fast through a busy shift, then I don't have to stop to eat, which is a positive. And if I get better mental clarity, it's going to be better. But it just never came to me. And I'm not saying that doesn't ever happen.
For sure. For some people, it works well. It's just when I look at it long term, food is fuel. Our brain needs fuel. Our cells need fuel. Muscles need fuel. We need a lot of fuel to keep going. You know, we have a calorie goal just to sit, just a resting rate. We need certain many calories. But I think overall, if you're eating in a 12-hour window, I think that's very normal and you still can achieve your weight loss goals. If you're doing some intermittent fasting and it's short term and you can gradually work into that longer time, then I'll support that too and I'll help you with that.
Yeah, and one of the other arguments towards it is it's supposed to help clean up things and has longevity benefits. And so I was trying to look into that myself on like, all right, is this something I need to be recommending routinely for longevity? And really, I just really wasn't convinced of the magic, cellular debris cleanup, increases sirtuins, and all these are like the longevity promoting. And I just wasn't convinced. And what I feel like patients aren't really working on teaching themselves how to eat,
Agree.
They're like, if I can white knuckle this for 2 days, I'm going to be down 15 pounds. And then if I can do it once a week for 6 weeks, hopefully I'll be down 30 pounds. But then it's like, all right, well, are we going to keep doing this? Or like,
but I think over time, like our body's like, whoa, what is going on? We're on a vicious, like a hamster wheel. We do something for 6 days a week. And then day number 7, we're going to do something totally different, or 2 days out of 7. I think it's that constant. We're just chasing and chasing. We don't ever have that set. What is manageable and what is sustainable and what's going to give us the best effect? Metabolically, I'm not 100% convinced that intermittent fasting is great metabolically long term.
Right.
And so again, what is metabolism? It's how quickly in our body's natural energy burning response. And so in order to burn, we have to have something to burn consistently. And I love the word consistency with patients. It's consistently, what are we doing to look at our weight loss goals, look at our training goals? What are we doing consistently to change our lifestyle? I think food and nutrition and exercise are the most underused forms of medicine.
Yep, exactly.
I do. And I think they're the most inexpensive forms of medicine, Yep. And so but I've always said that. I just think we underutilize good nutrition and movement.
No, and food is medicine. And sometimes some analogy I'll bring up with some people is like, all right, if you only had one car for your entire life, what kind of gas would you be putting in that car? Would just go get the old farmer diesel fuel that's all after refined and just extra? Right. Or would you be actively seeking out the highest octane, cleanest burning fuel because you're only going to get one car?
Right.
You better take care of it. And so if you do that as your body, let's put high octane fuel. Let's, give medicine, food as medicine. A simplistic way is foods that once had a pulse or were grown from the earth, are typically more micronutrient dense. Right. And so I feel like those are better. And then you feel better from them. And so those are the ones that how I'm trying to convey. It's like, and it's just so easy. Like these days, our food just tastes so gosh darn good and they strip all the nutrients out. Yeah. One of the things we were talking about is just a potato. A potato itself is super micronutrient dense. It's so filling. It's one of the top fillingest foods that's not a real word, but it's
fulfilling. Yeah, I get what you're saying.
and it's a good, but then you chop it up, salt it, throw bacon, cheese, sour cream, and now it's 600 calories extra.
Oh, for sure.
And now it's fried, so you can eat them on the couch and you can eat it all, and it doesn't have that nutrient consistency anymore. So it's that's why it's so nuanced. Everything about nutrition is nuanced overall. I'm going to bring up a patient scenario that I hear a lot that is hard for me to really identify what's going on a lot of times. So I'll say I'm gonna out females with their what social media calls girl dinners. It's like this is they give me this timeline throughout their day, and they like, well, I wake up, we're busy, I get the kids out of the door, I maybe have a cup of coffee, I don't have much of anything, and then lunch at work, I'm busy, I'm trying to get things, I may have like a meat roll up if I even eat anything, and then supper, I'm just cleaning up whatever the kids didn't eat, and so I don't eat enough, but I'm still 50 pounds overweight. How do you approach this patient? This is a difficult patient for me.
And it's a difficult patient for me too. So again, I hear that too. I hear that same scenario. And so then I dive into what's in your coffee. Where'd you get it? Is it a really fancy foo-foo, kind of coffee drink with lots of flavors and sugars and things? Are you mindlessly snacking and you just don't realize it? Your calories have to come from somewhere. We can't just say, well, I don't eat anything, but I don't lose any weight. So I think it's really hard to pinpoint where are you getting those from. That's where that calorie tracking is very beneficial and super helpful. So we can really identify where exactly, is this person getting their calories from. It has to be from somewhere.
Yep.
We can't survive without eating anything, nor our body's natural response is it's going to pull from its reserves if we're not eating anything, So I struggle with that too. I really have to dive in and just say, okay, think back to yesterday. Tell me everything you ate. Did you have a bite of, the snack you ate with your kids when you came home? Are you tasting the food when you're cooking supper? Did you drive through quick without realizing and think, I'm just going to get a kid's meal? But, where are these coming from? Because I, like you, it's just really hard to say you're not losing weight, but you're not eating but 200 calories a day.
Right.
Anyone's going to lose weight if you're in that low of a calorie deficit. So I agree, that's a hard patient, and I really would have to dive in more to, let's keep a food record. How much are you moving? Mm-hmm. That's another thing. I think movement's a big factor. What are your beverages? Are you hydrated? I think there's a lot of things. Are you doing any form of exercise? Are you doing any form of strength training? Are you just surviving? The other thing is poor sleep. Yep. Poor sleep when we have poor sleep, weight loss is really challenging. And so we have to look at all of those things, which is another thing of, when I visit with patients one-on-one, we dive into all of those things.
Yeah, and sometimes it's where calorie density comes up in my stuff. Sometimes it takes, and I should do better about making visuals of this, and I see them on social media at times, but it's like, go buy some ground meat of like 96.4 lean ground meat and then get your normal 80-20 and pull out 300 calories of it. And 300 calories of the 80-20 is like the small hamburger patty.
Right.
300 calories of
94
is like a plateful.
Yeah.
And this is more protein.
Exactly.
So it's not always about just eating less.
Right.
It's about eating
Where are
less.
they coming from?
Yep. Less calorie dense foods.
Yeah,
and
for sure. And I like to use the analogy sometimes too. Like I could have, an apple with peanut butter for 150 calories or I could have a handful of peanut butter M&Ms.
Yeah.
Okay. For the same calories. But one's going to have complete high sugar content with fats and a lot of added things. The other one is just more natural. It's the calorie content can be the same, but it's what it's made up of
Yep. That extra fiber from
Yes,
the apple
yeah,
is
yeah.
going to be filling, and
Fiber is not very important to I don't think fiber gets the reputation or the publicity like protein's getting
no,
right
it
now.
needs the protein marketing
Yeah, I
team.
know it does. Yeah, fiber's so good. Fiber satiety, it's good for GI health. It helps lower cholesterol levels. Eat your fiber.
Yep.
I can't stress that enough. And
It lowers colon cancer, and
yes,
they're
yeah,
getting lower and lower with colonoscopy recommendations, as this is probably from our diet
yeah.
that we're seeing increased risks. And so it was, I think, 55, then it was 50, now it's 45. I will probably consider it at 40, just because it's getting more
It's
and
more
more
prevalent. Yeah. Yeah, we have a strong family history of colon cancer in our family. So I've already started my screenings just because of my family history. And so I think it's so important. But fiber is so helpful. Fiber can do so many things. And I think as a whole, we don't eat enough fibrous foods. So
No, I think the American average, one of the studies or statistics I saw was like we average 8 to 10
8
grams.
to 10 grams, and the recommendation is 25. Yeah,
Yep.
so we're struggling in that area. Yeah, we're really lacking.
And so one of my favorite things these days, and this is like my night, because I like to end my meals with sweet. I get frozen blueberries and put it in Greek yogurt.
Yeah.
My brain thinks it's pie filling, so, and I just write it out. I don't argue with myself,
Yeah.
and
It's a good treat. It's high protein, got some carbs.
Get some fiber in there.
Some fiber.
And
that's where I really want to help patients understand it. It's just balanced eating. We need all the food groups. And so I think when we talk about weight loss, I think the stigma for so many years was calorie deprivation and elimination and getting rid of this, you can eat celery and drink water. I think that was the stigma for so long.
the Special K diet.
Yes, or the Subway diet all those
Yeah.
years ago, where he only ate Subway sandwiches, which was fine, but that was probably a way better choice than what he had been doing. So it worked. But I think it's just balancing good quality nutrition. And I hear a lot today, and you might too, I don't know, but groceries are expensive. I get that. And I oftentimes will have patients say, eating healthy is so expensive, So we do kind of have to break it down. Okay, you're a family of 4 to go to, say, Chick-fil-A.
Yeah.
You're talking $50.
Yeah.
Okay. It is quick. It is convenient. I am so thankful. Like, I'm a Chick-fil-A girl. I'm so thankful we have good options. A lot of our restaurants today, you do have some leaner, better options. But I think, too, the voice of temptation comes in when you're like, oh, I don't eat this very often, so I'm going to get the higher calorie, higher fat meal because it just tastes better, versus going to the grocery store and trying to, time is a factor. Families today are just so busy. We go from A to B to C to D, and by the time we get home, we're too tired to cook, or we don't get home until really late and we had to feed the family before 10 o'clock at night. And so eating out has just become so much easier. But grocery prices I understand grocery prices, and they're high. I get it. But I think we have to look for ways to be smart with maybe more frozen instead of fresh produce, again, we have to plan ahead. When we can plan ahead. I had a professor in college, I'm not kidding you, told us every day we walked into class, if you fail to plan to fail.
Yep.
He told us that every day, and that stuck with me, and that's in anything with life, not just, weight loss, or performance, trying to be a better athlete, or just, training goals. But I think grocery store, eating from the outsides of the grocery store, where you get your fresh produce or frozen, you get your leaner meats, you get your low-fat dairy, you have some options that are more natural. If those foods, you can still feed your family affordably, and there's probably leftovers, and there might not be, but it's a better option. You're not going to do that every night. I get that. But the inside aisles of those grocery stores, that's where you're going to find your processed, your boxed. If people in our field, we read the studies about processed foods, and what we're putting in our bodies is really affecting our health, not just now, but long term. I think if we all could look and, magic, an hourglass and look ahead or the future and be like, man, I wish I would have made better choices, nutrition and exercise, because now I'm affected by diabetes, heart disease, fatty liver. I think we might be a little more prone to making these choices and, eating better, just in general.
Yeah, because those aren't things that show up,
Right
within
now.
just 2 weeks.
Right.
It's like, oh, this is last decade of where I just, got busy with a family,
Yeah.
a career.
Yeah.
And, now I used to work out all the time and now I don't make time for it. And we used to cook at home, but we're just busy. So it just slowly, and then now you're pre-diabetic or now you're
Right.
30 pounds overweight
Right.
and trying to undo it, it takes an effort and
It
time.
does. Yeah. Yeah.
Back to I'll say the 90s Special K diet, nothing tastes as good as skinny feels, mantra. I do want to touch on just chronic dieting. I feel like people get into this rut of I just need to eat less and then they'll overindulge. Mm-hmm. And I mean, this is something I've struggled with is
Right.
like, I have been on a cut my entire life, basically, and this is the result of it, and so I've had to pull back and find more sustainable things myself. But where does chronic dieting, how is that detrimental? And do you ever have them periodize their eating plans, like purposely eat more or anything like that?
So the body is going to protect itself in times of stress or in times of, strain so I think we have to look at chronic dieting over time. It's perceived starvation. So our body's going to go into this kind of fight or flight mode when it's necessary. And again, I think your metabolism slows down, with constant eliminating. I think over time you feel hungrier, your hunger hormone is off. I think sometimes when we chronically diet or restrict calories, we move less. Just mentally, subconsciously, we're like, well, I haven't eaten much, so I don't have to move as much. So we just typically move less than we might have before. I think over time, chronic dieting, we burn fewer calories. Again, it goes back into that body's trying to protect itself from starvation. And so I don't see I don't think there's long-term benefits of that. The other thing is, again, we go back to we're missing out on so many key nutrients that food gives us. We're missing vitamins, minerals. We're missing key components to be healthy. I don't feel like it's a problem to keep your calorie goal, within a range that maybe you're eating less, but you're eating consistent and you're balancing that protein, carbohydrate, heart healthy fats. Like my husband, who's 6'3", he definitely can just sit down and eat a larger volume of food than I can, just our size difference. So I don't have a problem with chronically eating to sustain and provide, though it might not be as big of a portion as someone else, but I still have to meet my body's needs and my body's goals. Do I feel like taking a diet break, I think is what we've talked about. Do I think that's necessary? I think it can be helpful in times. I think it needs to be temporary. I don't think it needs to be long term. Yeah. But I do think that after a period of calorie restriction and reduction, if you find you're set and you're just stalled, maybe we do bump that calorie goal up a little bit just so our body's utilizing it a little more. And then we go back to an appropriate reduction in calorie intake.
I have to be really careful because I've been like, well, I'm going to loosen the reins a little bit. And that way I can, maybe get a little bit if I was trying to get stronger or whatever. And I can way overshoot it. If I don't have that level of restriction, I will fly off the handle. Yeah. So I pretty much have to have a little bit of restriction somehow all the time.
We're talking and I think when people think they can just go hog wild, like you're like, I just go overboard. I'm talking 200 to 300 calories a day. Yeah. We're not talking these big numbers. I think we bump up by, say, 200, 350, 300 calories just during that time frame. That's plenty, and I, like you said, just our mindset is, I can eat whatever I want these 2 or 3 days because I'm trying to, I'm not in a deficit or I'm not in a restriction period right now.
Yeah.
And then we're on a hamster wheel. we're chasing ourselves, constantly.
Yeah, and that restriction is what helps drive weight loss at some
Yes.
point. You got to find your restriction that works for you. And maybe that is time restriction. Maybe that is carb restriction. Maybe you are good at just eating 50% of everything that you typically do, but it is trying to find a real individualized, trying to find their level of restriction that they can adhere to long term that still allows them to get appropriate nutrition.
Right.
Even whenever we are using meds, GLP-1s, it's a fine balance because I don't want to crush their appetite to zero. I want to have it in the background to where it takes away. It's providing that level of restriction of where they're now more in control, takes the food noise away, they're getting full faster.
Right.
And so that's where the meds come in to help.
Yeah.
But we also, again, just work with them to try and figure that out. One of the things that still the chronic dieting, women specifically, I think they're coming around, and social media is probably doing a better job of this these days, but pushing the protein and realizing that strong is better than skinny. And I'm still I will say I'm going to out the older women, but they still struggle with this. Getting them to pick up a weight, they're still worried they're going to accidentally grow traps or something, do you have any
They're
tips?
Bulk.
Yes. Do you have any tips for women, in getting protein goals and encouraging resistance training with them or anything?
I agree. I'm very happy to see that the trend has changed from, thin is in kind of thing, like the skinnier the better, to where now we're seeing we need protein, we need strength training, we need to, build or tone the muscle that we have. We all have muscle, we all have it. And so it's utilizing it. And so I myself, being in this field, I've seen it. I've seen the trends come and go. And so something I really tried to do for myself, and I'm a middle-aged female who I know my risk, as other females, our risk for osteoporosis is very high. I'm also thin and petite and have small bones. Yep. And so I have to really be mindful that I have to take care of that now. So when I talk to my female patients especially, I say, just think of, protein as, and, think of resistance training as much as you do consider your cardiovascular training. They go hand in hand.
Yep.
Without one or the other, you're not getting your full benefit. And so I really remind them that strength training, 2 to 3 days a week, if that's all you have, that's perfect. It's better than nothing.
Yep.
If you can't get to the gym or you don't have a gym membership, nothing says that stops you. You can get some little hand weights for home, or moms picking up babies, day in and day out. You're getting some strength training. It's focusing on those good muscle groups, protecting our bones, and we're stronger in general. Like you said, we only have one body. We only have one shot. We got to take care of what God gave us in this one body, so we can be good caregivers. We can be good employees. We can be good, family members and things like that. So I tell my female patients, don't shy away from strength training. It is not the devil, I promise.
Yeah.
And I love that social media has changed that factor that, strong is in now.
Yeah.
And so I love that we're on that trend because I can totally support it.
Yeah.
I get on board with 2 to 3 days a week strength training. If you want to do a little bit more than that, fine. There's also trained individuals who can say, what are your goals? Most women, their goal is not to bulk, but it's to tone and be strong. Hey, I think that's a great goal. Mm-hmm. And then you find that professional who helps you get there. Yes, YouTube, Instagram, TikTok, some of those, they all have some pretty decent recommendations. Somebody who's starting out with strength training. I'm sure most women have friends who are strength training. So I think it's just, A, change your mindset. It is not a bad thing. B, let's try and be consistent and find some ways that we can sustain that, because overall, long term, it is for the better.
And you brought up a great point on osteoporosis and everything, and that is something that is, hip fractures are so detrimental that it's hard to really convey, and you just don't think about it because it's not something that really comes up until it happens.
Right.
And strength training really helps build that bone mineral density tremendously. And, and it may even help prevent the fall, but then if you fall, you'll bounce instead of breaking your hip or your
Exactly.
wrist.
Right.
And if you break a hip, there's a 50% chance within a year that you may die. And then of those 50% that live, 50% of those never regain their full motility or independence back.
Yep.
And so those are pretty staggering, statistics.
Yeah, I 100% agree.
To help prevent. And then it's like, whenever we're looking at longevity, muscle is the organ of longevity.
Yep.
And so the more you can get earlier, that doesn't mean it's never too late to start.
Oh, for sure.
But the more you can get earlier, then you can carry your grandkids in the airport. You can put your luggage in the overhead bin.
Sure.
You can do all of these things and still be independent in your 70s, 80s, 90s. So,
and we're living longer.
Yeah.
If you look at it like longevity, we're living longer. So again, I want to be able to do those things 10, 20, 30, 40 years from now. So like you said, some of these things, they don't show up today, but they may show up later. So we have to do what's in our control. Again, that's another important thing, is like what's in our control. We have to make decisions and change our habits and really make ourselves a priority. And that's hard because I've been that mom that everyone else is a priority. And, I've been in those phases and I know that's hard. And so it's hard for me to say, oh yeah, sure, go take an hour for yourself every day. That's unrealistic for so many people.
Yeah.
But when we say, you know what, we can choose what our family eats. Nutrition can be a family thing. It's not just a single person. Good nutrition is good for all ages. We can all find some ways to move together, to exercise together, to be more active together. We can make it a priority to, if you're stuck at home, YouTube has some good walk-in-place exercises. They have some resistance training. You can do wall push-ups. You can do some wall squats. You can do a lot of things without leaving your house. But again, it comes down to making it a priority and making it consistent.
We've primarily focused on weight loss and everything, but another kind of population that comes in through Live Oak is just guys and gals who are at healthy weight, but they want to build muscle. How does that change your tone and approach with them?
Again, I look at what they're eating, what their training program is like what are their goals? What are they after? And so we're going to tailor that nutrition to what those training goals are. Are you more resistance training, wanting to build muscle? Are you training for an event? Are you training for a long run? Are you training for a half marathon or a marathon? Or, what is your goal and what are you training for? And how can we help with that? I definitely will tailor that nutrition visit or sessions, to what that goal is, because your body's utilizing nutrients in a different way. And so again, it still comes down to nutrient utilization and how we get what we get, when we get it, how we eat, how we drink. I think it all comes down to that. So yes, I would definitely tailor that to a patient, specific to what their training regimen is or what their goal is at that time, if it's not weight loss.
And this is one where I'm going to out the guys, but guys get so scared of carbs that they're trying to work out and do these strenuous workouts with minimal carbs and minimal fuel, and I have to tell them, you don't have to be scared of carbs.
No.
They are going to fuel your workouts,
right?
And help you recover. And so that is something that I have to really harp on the guys, is bro, you're eating 30 grams of carbs for a day and you're trying to work out for an hour and a half, 2 hours.
Yeah.
You're going to burn out.
You're going to burn out. I think what the rule is, for every 30 minutes of exercise, you can water, or it's 75 minutes. Water's pretty appropriate. But if you're going to go 75 to 120 minutes, you need 15 to 30 grams of carbohydrate plus your hydration. And then for anything 2 hours post, you need electrolyte replacement plus carbohydrate.
Yep.
So that's, I think, again, carbs are fuel. They're
Yep.
our fuel source. Our muscles crave that, And again, recovery is very important. You don't fuel appropriately, you're not going to feel this. You're not going to have the strength to complete that strenuous workout, but you're not going to recover well. You're just not.
Right. And then let me see. What else do I want to? I guess we could talk about just supplements. Are there any supplements that you feel need to be a part of most people's weight loss journey?
I obviously feel like, again, protein's very popular right now, but I do see there's a lot of good things with the right kinds of proteins. So I think protein supplementation is appropriate. Supplements as far as vitamin D, magnesium. Most people are vitamin D deficient.
Yep.
So I think that supplemental vitamin D, I think we all could take it and be totally fine. I don't like looking at that lower end of normal. I want to be in the middle to higher end of normal, so vitamin D. Magnesium affects our sleep, brain health, brain fog. I think magnesium can help stress levels. Gosh, I really didn't realize how beneficial magnesium was until the last few years. But yeah, magnesium is super powerful. Probably, too, what's still pretty popular, but what's trending more with females is the creatine supplement. I think that's been a part of a lot of male training programs for many years, but I see it's really, they're targeting the women now. And I don't think it's a bad thing, especially perimenopausal women.
Yep.
I think creatine is great. It gives hormone support. So I think that it's one can help with metabolism. It can help with strengthening. So I think it helps after a workout, helps regeneration.
Yep.
And so I think it's great. So I would say if you're going to try and supplement something, and that can lead to a whole nother discussion on supplements, is like your vitamins and minerals. So I'm going to go off for a second. If you're deficient in something like a vitamin D or, any of your vitamins, treat the deficiency for sure. Like always treat the deficiency. I think everybody needs a good multivitamin, multi-mineral, something, because we don't eat what our body requires. Like we just don't eat enough, or we're not eating the right things in general. So supplementation, I feel, is very appropriate, especially in times of deficiency. Supplementation is great for somebody who's had bariatric surgery because their volume of consumption is so low, so little. Somebody who has malabsorption, supplementation is 100% warranted with pregnancy. So there's many areas supplementation is important. But again, vitamin D, even omega-3s.
Yep.
I think omega-3s are very important. I supplement with that every day. The thing with omega-3s, and I want to remind people, is omega-3s don't necessarily turn off the inflammation in the body, okay? But I think that they help resolve some of it.
Okay, cool.
That's how I look at that omega-3 is.
Yeah.
We all have inflammatory issues. We do. So there's always going to be some inflammation, but omega-3s are going to help resolve it or tone it down some.
Gotcha.
And that's just a standard fish oil supplement, you know? So we can get it in fish, the EPA, DHA, all of those can be confusing. But I think omega-3s are fantastic. It also can help with lowering triglyceride level.
Yep.
I think it can help with metabolic syndrome. I think there's some benefit, what I'm reading, with rheumatoid arthritis and some of those. So obesity-related inflammation, get on those omega-3s.
Yeah,
I think they're so important.
We promote omega-3 a lot, and I even really like the high-dose fish oil, 2 to 4 grams mixed between EPA and DHA, and that's a lot higher than
it is.
You typically buy at the store. And so I purposely carry super concentrated one so that you don't have to take a dozen pills.
Yeah.
And I also make sure that they're from a good brand so that they're not rancid and they have good control quality and they're sourced good from not, mercury rich, whatever. Yeah. So
I think that's important too. When you ask me about supplements, it's where are you getting those supplements from?
Yeah.
They're not really regulated by the FDA per se. So I think that there's still some really good supplements and supplement companies. out there. I have looked at y'all's actually.
Yeah.
So I do know, like, I like where you're getting them from. But I think there's a lot of not so good ones that you're going to pay a lot of money for in other places. You just have to be mindful, educate yourself.
Yep.
Yeah.
And that's what, I was hesitant to bring anything on, but I purposely made sure that they're, dosed appropriately, that they're sourced appropriately. And so if you send them off for third-party testing, they're going to come back with what they say there is. Whereas
Yes.
like on Amazon, they're just not regulated.
Right.
And even like the ones that we carry, I have to sign a disclosure that I won't sell on Amazon, because what they are even having is people were using the bottles and then filling like sugar pills in there.
Placebo
And so,
effects. Yeah.
one other thing I want to ask is just about artificial sweeteners, zero-calorie sweeteners. What do you think about those?
I think there's a place for them. Sugar and its, high fructose corn syrup and some of these sweet, sugary things, they're calorie contributors.
Yep.
So, and they're not great sources of nutrients. I think we have to look at, again, total calorie control. Where are my calories coming from? So white sugars, concentrated sugars, they're not the greatest options. There are a variety of alternative sweeteners. There are some that I am not as probably in favor of as others. I don't mind like a stevia or a monk fruit or something that's natural. Those are definitely just they're very natural, I think you have to look at chemical compounding and chemically compounded sweeteners, and I don't think that those are the best option. I really don't even ever encourage sugar alcohols, because our gut just doesn't really absorb that. It just doesn't really like them. And so I don't think that they're the best option. So when I say sugar alcohol, I mean something like a sorbitol or a xylitol, mannitol, maltitol, all of those. I think there's some better options out there that I'm fine with some sugar alternatives, especially for patients who are trying to watch their sugar intake, Also, you look at added sugars versus natural sugars. Mm-hmm. So the more natural sugar and more natural sugar alternative is always going to be a safer option.
Yeah. I like them a lot, especially I will recommend them, somebody who's downing any amount of soda that's not one of these alternatives. I mean, it's such a low-hanging fruit of hey, here's 250 calories saved just by switching to a zero-calorie
yes,
option.
100%.
And it's look, I know you love your brand name Dr. Pepper, but there's 1,000 options that have 0 calories. If you're trying to be in a weight loss journey, there's going to be one that you like. There's so many options.
Yeah,
just
beverages there's a lot of sugar in a lot of beverages. I just don't think people realize, there's just so much sugar in some of those. And there's so many options today. Even the zero sugar carbonated flavored beverages. You like the carbonation, you kind of like the burn of when it goes down. Yeah. We got an option for you. Yeah. I do, going back to our protein, I do like the clear protein that you can mix in your water. So when we're really stressing hydration and protein intake, we can, 2 for 1. I think those are good options that you're tackling hydration and boosting your protein some. So I'm not a fan of sugar beverages, and I feel like we live in sweet tea capital of the world.
Right.
I feel like when you ask for a sweet tea, it is, in my mind, I am giving myself diabetes right now because it is so sweet. I call sweet tea diabetes in a cup. Some of those
and here is really bad.
It's really bad.
I don't hardly get it anymore, but whenever I used to, it's I can chew this one. The
it
sugar,
leaves a film on your teeth or in your mouth. Yeah, so sugar, you have to really be mindful. I just don't think I used to have this display in my office of the little test tubes full of sugar, and they would be this many grams or this many grams for certain things, and you would be amazed at the amount of sugar in soda and in juice, in Gatorade, what we used to give our kids to replace electrolytes. Gatorade's loaded with sugar,
which in 2-a-days West Texas football may be appropriate.
Okay, appropriate.
But not sitting at your desk.
Or just sending it with my kids in their lunch every day. Just having that source. So you just, again, as dietitians, we really look at and we focus on what are you doing? What are your goals? And where can we start helping you make those changes? And so that is completely our mission, is helping these patients become healthier, living longer, feeling better. One of my favorite things is when patients tell me I was able to get off of some of my medicine.
Right.
And I think that's huge as healthcare providers and practitioners, is that's what we're aiming for. And so all of these things, we all play different roles in different parts. And one thing I love, about Live Oak is we all have something different that's helping the well-being of that client, that patient. So we just want them to live their best life.
Yeah, and bringing you on board allows, again, your dedicated time to where you're not having to worry about throwing out medication side effects or just all the different aspects of the medication. It's just purely nutrition, lifestyle, and that's just not something we can feasibly cover.
Right.
Well, you're just going to do better than us at baseline.
Yeah.
And so that's
Yeah.
why I'm very excited, very thankful.
Yeah,
that
I
you
love it.
came
Yeah,
on.
I love it. I'm excited.
To wrap up, what are 3 actionable things that people could do to get better nutrition in their day-to-day?
Ew, okay. We're going to drink more water.
Okay.
Nothing less than 80 ounces. That's my goal, even for somebody my size. Move your body.
Okay.
I want you to move. Even if it's getting up from your desk and walking for 5 minutes, morning, lunch, and before you go home. Let's move more. We just need to move. Get our protein in.
Yeah.
So I think protein's so important. And then, as I told you, we were like, schedule to see the dietitian. We want you to come in. We want to schedule with you. We want to help you meet your long-term goals, whether it's weight loss, performance, whatever it is.
Awesome. Well, thanks for coming.
Yeah,
Thanks for
it's been good. It's been great. Thanks for having me.
Podcast initiation.
Oh my gosh, yeah. Podcast initiation. Yeah, it was good.
Awesome.
It was good.
Thanks for watching. We do have Nicole on staff now, and so if you want to meet with the dietitian, again, to have dedicated time for nutrition only, where we're not just focused on meds, and get her insight, feel free to text or call us, and we can get you scheduled.